As a member of the Red Cross blood collection staff, you have a responsibility not only to make donors feel good about the gift they're giving, but to make them as comfortable as possible during the collection process. This video outlines the basic procedures of blood collection: vein selection, skin preparation, and venipuncture. Follow the blood services directives for preparing the donor. Ask the donor his or her name, social security number, and date of birth.
And I'd like for you to repeat your name for me, first and last.
Robert Hillman.
Now, Robert, may I call you Bob?
It's fine, thank you.
Make sure that what the donor tells you is consistent with the blood donor record, or BDR. Make sure the BDR is complete and legible. If you see omissions or mistakes, correct them now.
Good.
Before you select a vein, examine both arms.
And do you recall which arm was used before?
Right arm.
Okay, that one looks good.
If you see rashes or scars that may indicate the use of self-injected drugs, defer the donor.
Let you lie down and be comfortable.
Follow the blood services directives, the BSD, for positioning the blood collection set. Putting the whole blood number on the BDR and post-donation and callback instruction. Place the clamp on the tubing between the needle and sampling site. You are now ready to make the final vein selection. When selecting a vein, you need to consider 4 things: location, condition, direction, and size. Look for a vein in the antecubital area. That's the area about 3 inches in diameter where the arm bends. Center veins are usually deeper than side veins and will give you the best collection flow. Center veins are surrounded by tissue and muscles which help to support the vein and allow it to remain distended throughout the collection. Veins that lie diagonally over the inner or outer aspect of the arm are large, but may be located over bone or muscle and may be lacking in good tissue support. Remember, the most desirable vein is not necessarily the most visible. The deeper center veins can be identified by palpation. A good vein feels like a rubber tube when you palpate it. Palpate for veins that have good turgor or fullness. Good turgor will support good blood flow, and it will prevent the vein from collapsing after the needle is introduced. You can evaluate the turgor of a vein by pressing down on it firmly and testing its resilience by feeling for a bouncing back sensation. Try not to use veins that are large and bumpy. Bumps are indicators for valves, which can interfere with the blood flow to the needle. Choose a vein that is relatively smooth, pliable, and resilient, with its valves well spaced. The direction of a suitable vein follows a course that is fairly straight. This straightness will enable you to properly thread the needle into the lumen or channel of the vein. Sometimes visual examination and palpation may not be enough to identify a usable vein. If you use a blood pressure cuff, pump the gauge to about 60. If you use a tourniquet, make sure it isn't too tight on the donor's arm. You should be able to insert 2 fingers between the tourniquet and the skin. Ask the donor to make a fist or squeeze on a hand gripper. Any change in the donor's position can alter the position of the vein you have selected. After placing the donor in proper position for venipuncture, palpate the vein again to be sure the vein hasn't shifted. The recommended point of skin entry may be up to 1.5 inches below the bend of the elbow. This allows threading of the needle into the vein. For difficult veins, a surgical marker may be used to mark a donor's arm. To help the donor feel comfortable, explain what you're about to do. Gather all the supplies you're going to need and place them in a convenient location before proceeding with arm prep and blood collection. Now you're ready to prep the venipuncture site. The site has to be prepped in order to prevent the blood from being contaminated during needle insertion and withdrawal.
Are you allergic to iodine?
Ask the donor whether he or she is allergic to iodine. If the donor is allergic, follow your region's procedure for using other prep supplies. Scrub the antecubital area with an Iodophor PVP swab or alcohol swab. Using a random motion, scrub an area 3 to 4 inches in diameter for at least 30 seconds. Then apply the second arm prep solution, again with an Iodophor PVP or alcohol swab. Beginning at the intended point of needle entry, swab in a concentric outward pattern. Cover an area 3 inches in diameter. If you go back over any part of the area, you must redo the second swab. If any part of the prepped area is touched or contaminated in any way, repeat the arm preparation from the beginning. Ask the donor to keep the arm still. The scrub solution needs to dry for at least 30 seconds. You're about to perform the venipuncture. Put the donor at ease with a little conversation. Inflate the blood pressure cuff, or if you're using a tourniquet, tighten it just enough to distend the vein. Remove the needle cover carefully. Give it a 1/4 turn and then pull it straight off. That way you won't remove the silicone coating or damage the needle. If the needle cover is loose and doesn't snap when you turn it, do not use it, because the collection set may be air contaminated. Discreetly inspect the needle to be sure there are no barbs or defects. Now, touching the skin below the prepped area, pull the skin tight. This helps to anchor the vein and counterbalance the thrust of the needle. Venipuncture involves 2 thrusts of the needle. At 1/4 to 1/2 inch past insertion, position the needle at a 20 to 30 degree angle and continue to insert it bevel side up. This should all be one smooth, swift motion. Thread the needle carefully inside the lumen or wall of the vein. Generally, if 1/2 to 3/4 of the needle lies within the lumen, the needle will stay inside the vein and the flow of blood into the needle will be easier. Here's another way to handle a small or movable vein. When you insert the needle and the bevel is completely under the skin, palpate the vein before making a second thrust. Remember the importance of proper vein selection. If you choose a vein that's too small, there won't be enough room for the needle, and the bevel may rest against the vein wall, slowing the blood flow. After insertion, remove the tubing clamp to confirm blood flow. Note the blood flow start time to record on the BDR. Engage and stabilize the donor care needle guard by taping. This will keep it from twisting or rotating. Tape across the donor care needle guard to keep it in place. Be careful not to tape the needle down too tight, because this could push the bevel against the top of the vein and obstruct the flow. Place a sterile gauze over the venipuncture site. This will prevent airborne contamination. Reduce the pressure on the blood pressure cuff or tourniquet. Document and collect the unit following the BSD. During the collection, frequently mix the blood and anticoagulant by lift tilting the primary bag 90 degrees. This avoids clotting. When the blood bag is full and the tubing clamped, observe the blood flow stop time to record on the BDR. Fill the sample tubes following your region's guidelines. Agitate the tubes 8 to 10 times. Clamp the tubing behind the donor care needle guard. Decrease the cuff or tourniquet pressure. Remove the tape and pull the needle straight out. The needle will lock in the donor care needle guard. Do not press against the site. Immediately apply gauze over the venipuncture site and ask the donor to apply slight pressure and raise the arm for 3 to 4 minutes. Now you'll complete the collection process. The tubing blood must be stripped within 4 minutes to avoid clotting. Complete the documentation following the BSD. Before releasing the blood unit, recheck all whole blood numbers on the collection set and tubes to be sure they are the same on the BDR and the post-donation callback instructions. Send the blood and BDR, along with any consent forms or other paperwork, to the processing station. Lower the donor's arm and check under the gauze to make sure there is no bleeding. Then, apply a bandage over the venipuncture site. Explain post-donation care to the donor and how to use the post-donation callback instructions.
Now, on the bottom part is going to be your blood number, and if you leave the site and change your mind about the safety of that pint of blood, you're going to call the toll-free number and give them your blood number.
Okay.
Okay?
Express your thanks.
No.
Okay, great. You did great, and thanks a lot for coming in
Oh, no
and
problem.
donating today.
Don't let the donor go without making sure that his or her condition is stable. Whether your donor is giving blood for the first time or has given many times before, your professional skills will help bring that donor back to giving the gift of life.